you sought out the office because you're having some pain. Can you describe kind of what's going on?
Yeah, so the pain, it started when I got a deep cleaning in July of 2020. They propped my mouth open for 2 hours with a bite block. And then the next day I was in the hospital with excruciating pain. I was in so much pain. I was shaking, I was screaming, I was crying. It was absolutely terrible. I didn't know what it was. The pain it started over here. And it was like this deep pressure pain. And then
So the cleaning was on the right side.
The cleaning was actually on the left side, and they put the bite block on the right side for some reason.
Gotcha.
Yeah. And then it took about 3 weeks, maybe to a month before the pain went away. But the thing is, usually when I'm stressed out, I tend to clench. So I started clenching more because I was stressed out about work. And the more I clenched, the more I'd be in pain. But I didn't connect the two, so I kept clenching. And the more pain I was in, the more stress that I was in, so I would clench even more, and then the pain would be even crazier. And it took me about 4 or 5 months to find out that I had TMJ. I saw many doctors. The thing is, I didn't have insurance, so it was really hard to see doctors. I was trying to fix it on my own, but yeah, it didn't really work. I did see a neurologist who told me it was probably TMJ. So I went to see a bunch of dentists. I saw a chiropractor who did massages inside of my mouth. That didn't really help. Because he told me to open my mouth so wide, and it made the pain a lot worse every time I went to see him. And then I went to see. By that time, the pain progressed. It became even worse. Now I started feeling pain in my temples, so a lot of pressure pain in my temples, my jaw. I was hearing a lot of clicking noise, popping noises, and yeah, the pain was absolutely unbearable. Most days I would be in bed, moaning in pain, trembling, shaking. I would get like electric shocks in my face, especially on the right side. It felt like someone took a hammer and hit me with it on the side of the head every day for months and months and months, and the pain was unbearable. And I found a dentist that wanted me to have a splint, so he made me a splint.
Did it help?
No. Well, the thing is, I have a really bad gag reflex, so every time I try to wear it, yeah, I would gag, so that didn't work.
Was it a lower splint or an upper splint?
It was a lower splint, okay. Yeah. And the people that I was seeing, the because it was the chiropractor and the dentist, they were working together on me. They pretty much said, well, there's nothing we can do. Your case is a little bit too complicated. You probably have trigeminal neuralgia. Maybe you should get your wisdom teeth taken out, but at this point we can't do anything for you. And they said, yeah, we feel bad for you, that sounds horrible, but yeah, there's nothing we can do. And after that I became really, really depressed, and the pain was, I was so stressed out about the future. At that point I'd been in pain for 7 months every day, and it was getting worse and worse and worse, and so the depression was getting to me, and I saw really no light at the end of the tunnel until I posted something on Facebook in the TMJ group, and then you replied to me and gave me some hope. I didn't know DTR was a thing, but the science behind it makes a lot of sense. My bite is really uneven. I can feel it when I close my mouth. The back teeth hit first on the right side, and that's where the pain is. So I felt like, yeah, DTR in my case would really be beneficial. So thanks for seeing me today.
Yeah,
really
well,
appreciate it.
So when was the cleaning where all of this thing kind of ramped up for you? When did that happen? Was it a year and a half ago? A year ago?
It was July 27th, 2020. So
Not quite a year yet.
Not quite a year, but yeah, almost.
So what are you doing to alleviate pain? Are you taking pain meds? Do they have you on anything?
For the longest time, I had nothing, and I was fighting with doctors to give me painkillers because I figured those would work. Because I've taken them in the past when I had surgeries, and they would really work for pain. And I went to see specialists after specialists, and they finally gave some to me. And the pain went down by 80% with painkillers, and I'm on like really high doses of painkillers. I'm on 60 milligrams of hydrocodone a day. And yeah, it does help, but it does have some side effects. So I like to be off of those.
Sure.
Eventually, they try to put me on, I think they're called tricyclics, amitriptyline, triptyline, or something like that. It made me have brain zaps, and I was pretty much getting electrocuted all over my body constantly. The side effects were terrible, and it didn't even help with the pain. But yeah, so like, in the muscle relaxants, I felt really terrible on them. Same thing, it didn't help with the pain, and so yeah, the only thing that really helped were the strong opiates. But yeah, I can't be on those forever. The side effects are bad, so.
Sure.
Yeah.
Okay. So where is your pain threshold at today? Like, is today a good day for you? Is today a bad day? Are you in the medium kind of the spectrum?
Well, for some reason in the last 2 weeks, I've been using my jaw differently when I'm eating. So I've been eating on the left side. I've been learning to not move my tongue too much. Like, so what I used to do was I would move my tongue to the right side. Let's say when you're eating, usually you'll use your tongue to get food unstuck from different places. So I'd stop doing that because basically when I did that, the pain would be extreme in this area. The muscles are right here would get activated, and I would feel deep, extreme pressure pain. And since I've stopped doing that, then it has been a lot better. But also I'm on painkillers, so that helps. But when I wake up in the morning, I'm probably at a 5 or 6. And then when I take painkillers, I'm probably at a 2 out of 10. But yeah, like 2 weeks ago, before I started before I started training myself to use my jaw differently, my tongue differently, I was looking at a 9 or a 10 out of 10 in pain. So yeah, like shaking constantly and just crying and moaning in pain. I mean, it was just absolutely terrible. I didn't know it was possible to be in that much pain. But yeah, so it's been a long road, and I'm happy to be here.
Sure. So are you having headaches with this?
Yeah. I mean, I'm not sure if they're really headaches. It's just a lot of pressure around the temples area and in this area. I feel like someone is putting my head into a vice and it's trying to, crush my head, squeeze. Yeah, that's kind of the feeling that I get every day. Yeah.
Okay. Do you feel like you can open wide, or do you have some restriction in range of motion?
No, it is difficult for me to open my mouth wide, and I try to not open it wide if I can. But every time I eat, it is really painful. And the first time I open wide in the morning to eat something, I feel like it's a little bit stuck. Like it's hard for me to open wide.
Okay.
I feel like there's some restrictions for sure.
Speaking of the restriction, are you changing your diet for softer types of foods or liquid foods or smoothies?
Yeah, I was on a liquid diet for a while and I lost a lot of weight, so I had to stop doing that. But yeah, I try to eat soft foods, yeah, for sure. It helped a little bit, but the pain is still there.
Okay. And is there any involvement in your neck or shoulders?
Yeah, I have pain in my my left shoulder and left of my neck, the back of my neck. I don't know if it's related or not, but I mean, it started when I was surfing a few years ago, and I had to stop surfing because I had so much pain in my neck and shoulder. But it could be TMD related. I'm not sure, or surfing related.
Sure.
But yeah, I do have pain there.
If I have you just rotate your neck, how far can you go to the? Okay, good. And then go to the other side. Okay. So you have pretty good range of motion.
Yeah.
Does that hurt when you do that? The tension?
A little bit, yeah.
Okay. All right. So we've kind of already done our consult before you got here.
Yeah.
And we know that there's an issue with the right side.
Mm-hmm.
Okay. So the issue seems pretty straightforward. We're going to make those corrections and see how you feel on the other side.
Okay.
Any questions?
Is the procedure painful?
Nope.
Or no?
Nobody gets numb for this procedure.
Okay.
Biggest complaint is your mouth's going to get dry.
Right. Okay.
And most of the work is going to be done today. Follow-up visits will be much shorter in duration because that's just kind of fine-tuning the work we did today.
Mm-hmm. Okay. Sounds good.
All right.
All right.
Good.
The day of the procedure, I was still in pain most of the day, but the next day when I woke up, it was easier for me to open my mouth. It was a lot smoother, and I was not as much pain. And I would say that the occlusion was so much better. My teeth were, I feel like it was almost like 50-50 bite force on each side.
Sure.
Which I never really experienced before. So I would say, yeah, the first few days were absolutely amazing. I didn't have any flare-ups really. I was still in a little bit of pain, but nothing crazy. I was still taking painkillers, and when I took the painkillers, the pain was pretty much zero. And yeah, that was amazing. And then, well, the last few days I did get a few flare-ups. It's actually kind of painful right now, but the flare-ups that I have now are not as bad as they once were before the procedure. It's not like I'm shaking and moaning in pain for hours. It's nothing like that. It's more like the pain is there. It's really annoying, but it's not as bad. And I guess I was expecting for the pain to be gone by now, but I guess I should probably lower my expectations. Also, I didn't really sleep that well this week. But overall, I think, yeah, it was a success for sure, and I hope that it will get better and better, because yeah, even the pain that I'm feeling right now is still, it's an annoyance for sure. But yeah, I'm grateful for everything that you did for me, and I don't know what I would have done without this procedure. I mean, I guess I would have been in pain for another 10 years or something. I don't know. A lot of people are in pain forever, and they just don't know how to fix it.
Yeah, it just doesn't go away.
It doesn't go away, yeah.
Yeah. So, and it manifests differently across the board among different patients. So, when you start getting those zingers, you know, yeah, I think one of your providers mentioned the word trigeminal neuralgia.
Yeah.
So, okay, well, if that's it, then I need to go and have the MVD done or the gamma knife, and sometimes that works and sometimes it isn't. So,
Yeah.
you know, what do I really have is the big question.
Mm-hmm.
So, you know, the talk about, you mentioned you had, you know, 3 or 4 days of really, really good, and then things are starting to ramp back up on you. That goes to show you why this is not a one and done procedure. Like, you have to have changes made
Yeah.
in the bite as you're healing to allow the inflammation, the waste products in the muscles, inflammation to go down, the swelling to go down, and then you start feeling better for longer periods of time. So, and in your text to me, you said, I think it's going to take a while for my face to really heal. And
Yeah.
that's true. So patients will oscillate back and forth between, oh, it's a really good day, oh, it's a really crappy day. But
Yeah.
generally what gets, you know, what I hear from them commonly is that, well, I wish it would all go away, but my bad days are nothing like my bad days were previously. And
Right.
you've already stated that, even though it's only been a week.
Yeah.
So, what we're going to do today is basically the same thing, a shorter version, where we're just going to check your bite,
Yeah.
make any adjustments that need to be made, and then we'll see you again here in a few weeks or a month. You know, whatever it takes to
Makes sense. I feel like my bite changed a little bit. It's not as the occlusion is not as good as it was a few days ago.
Yeah.
It's not. It's a little bit muted now. Still on the right side. It hits first. Maybe that's why I'm experiencing pain right now. But yeah, it was. Yeah, I had really amazing like 3 or 4 days, and I was like, okay, well now the pain is gone forever. And the pain came back, and I was really disappointed. But it was good to experience. Being pain free was just so amazing. Especially when I was camping out there, and I could really enjoy nature and not be in pain. That was something really special. So, thank you.
Well, you're welcome. And my guess is, you know, what happens is, you know, the swelling and the inflammation is in the joints too. It's in the whole system.
Yeah.
And so when things start feeling better, the bite, people say, well, how can the bite change? Their teeth. Yeah. Well, because there's a whole bunch of soft tissue that makes those teeth come together. And so the muscle physiology changes, swelling comes out of the joint and whatnot. And so now the teeth strike each other slightly differently. And it doesn't have to be a lot before the neurology is turned back on. Now, it's not turned back on full force, but it's turned back on enough that you're like, you know, I thought I was done with this.
Yeah.
So it may be that, you know, you're dealing with this on some level for the rest of your life. Okay? Although I have plenty of patients who are like, you know, I don't take medication, I don't do anything else, but just have you check my bite once a year and that's fine.
Yeah.
And then sometimes cases are more complex and we may need something like chiropractic to kind of straighten out the back and the neck, because the bite can throw that off.
Yeah.
But it seems like most of your stuff was shoulders up for the most part.
Yeah.
Okay. Good. Well, you said something about the video from your girlfriend took of you a week prior to coming to the office.
Yeah.
I'd like to see that.
Yeah, I can send it to you. But a week and a half before that, I was just shaking and moaning in pain, and I think I've never been in that much pain before. And my girlfriend took her camera out and was like, I'm gonna start recording because, well, we both wanted the whole world to know. You know, in case I got better, I wanted people to know how much pain I was in, and then, you know, that I got better, and, you know, it did get better. So I think it's important to record these things, and so yeah, I'll send it to you.
I think it is too, and I think that the medical and dental professions are clueless for the main part, although there's some really great operators doing great things.
Yeah.
As far as how far do the effects of occlusion affect the rest of the body, and how tense can this pain be? Because a lot of us are just ignorant.
Yeah.
Good intentioned, but ignorant. And the only way you open eyes is to share the information. And so, you know, I've written papers, but papers don't really change paradigms. It's when doctors see a patient in so much pain, and they're like, well, how was that accomplished that he feels better now? He's not wearing a splint. He didn't take medication. He didn't have surgery. He didn't do Botox. So what is it? And so then eyes start to get opened, and it's a very slow process. But what's a faster process is patients seeing, hey, I know Luke. He's been on the forums for the last 7 months,
Yeah.
and he's got a lot of the same pains I do. And then you get better, and that gives other people hope
Right.
that there is a solution. And this may not be everybody's solution, and that's fine. But it was so simple to do. Why wouldn't you at least rule it out
Right.
before you commit? Because even if you do like a night guard, even if that night guard had worked for you, every second of the day that it's out,
Yeah.
you are sliding backwards.
Yeah.
Every second of the day that it's in, you're going forwards, right?
Yeah.
And there are plenty of people who come in with just bags of those things where it may have worked for a period of time and now it doesn't work at all.
Yeah.
So,
Yeah.
okay. Anything else? Otherwise, we're just going to jump right in and.
No, I think that's it.
Okay. Been in touch with Dad?
Yeah, he's been impressed by procedure, I guess, because he didn't really believe that it would work.
Sure.
I had many surgeries in the past, and every time I had surgery or anything like that, it would make everything worse. So
Okay.
he was pleasantly surprised. Yeah.
What about girlfriend?
Yes, she was really happy to hear that I'm doing better also.
Good. Good. All right. Well, I'm glad you're doing better.